I am Dr. Sachs, and I will be your attending physician for the day. Now, let's take a look at your chart. I see. Okay. Well, according to your chart, you notice some blood in your toilet this morning. Is that correct? Okay. Now, was this directly after a bowel movement? It was. Okay. Well, first, what I would like to do is just assure you that it's most likely nothing to worry about. I really cannot count the number of patients that have come into the clinic with concerns that they were bleeding internally or possibly had an aborted child within their stomach. But it always turns out to be the same thing. One of two things. The first, a case of hemorrhoids. The second, a slight anal fissure, which is just a very fancy term for a tear in your butthole. Now, what color was the blood? Was it a bright red? The kind of red that you would see when you cut a baby cat's neck? Okay, that's good to hear. What we don't want to see in these cases is a sort of black color. Black indicates old blood, which would indicate a problem. But since you have said that it was a bright red, there's really no need to worry about that. Now, can you tell me the approximate size of the bowel movement in question? Well, it doesn't have to be exact, just an approximate. So, the size of, say, a small sausage or a hot dog. So what, in terms of size, just a comparison like that will suffice. Oh. The size of a 16-ounce can of beer, you say? My, that's quite a large bowel movement. I'm fairly certain that before even examining you, I know the cause of the blood. Now, when we talk about blood, you've indicated that it was a bright red already. Now, the amount, are we talking a thimble, or are we talking about the aftermath of the Manson family murders? Okay, so quite a bit. Well, the best thing to do at this point, first, is to glove up. Anytime that I'm in a patient's nether realm, I tend to glove up. Oh yes. Like a glove, as they say. Now, we got here. believe that one of the nurses has left my medium gloves somewhere else and replaced them with extra small. But fortunately, I was able to fit inside. It's not the first time that I've said that. Now, we're gloved up. Now, if you would, I need you to drop trowel and assume the position. And I will, I'm just going to shed light. I'm not going to, not like that. So, yes, just go ahead and have a bend this way, and I'll have a look. Oh, yes, just like that. Okay, oh, wow, I didn't even have to spread them. You just can see right in there. Oh, my. Oh, yes, indeed, you have a fissure here. Oh, wow, it's very large, quite bloody. Okay. Okay, that's fine. You go ahead and pull your pants back up for the time being. Wow, that was some bowel movement that you had there. I served for a time in the French Foreign Legion as a youth, and during that time we were conducting operations in Africa. And during my time in Africa, I once saw a lion attack a gazelle and tore limb from limb, ripped the flesh from the body, and blood and intestines and gore was everywhere. Now, not to alarm you, but Uranus resembles the carnage from that day, which still haunts me even now. But not to worry, because we can get you fixed up. But first, I believe that we need to have a very serious discussion about bowel movements, because quite frankly, for the amount of damage that you have sustained to Uranus, that would require it would require a poo of monumental proportions. Can I ask, what is your diet like? For example, what did you eat yesterday? 3 pounds of roast beef. A box of Lucky Charms. A gallon of whole milk. 3 cheeseburgers. Okay. And 2 glasses of water. Did you eat all of this at the same time? Okay, of course not. Who would drink water and milk at the same time? Am I right? Now, actually, on hand here, I have a chart that will explain everything. Hold on one moment. As you can see, if I can find my pen, this is my poo chart. And in this chart, I will describe to you the types of poos and how to get the poo that you desire and that your anus desires. First, brief lesson on the anus. Now, unlike the female vagina, the anus produces no lubrication. Thus, if you have a poo that is extremely hard, it is going to be hella painful. This is also why homosexual sexual intercourse between men is quite painful. Not that I would know. Not that there's anything wrong with that. But it would be. Moving on. Now, the poo that you described to me earlier is probably a type 2 or a type 3. Now types 1, 2, and 3 usually indicate some degree of constipation. These poos tend to be quite hard. And as you see, type number 2, also known as the lumpy sausage, has hard ridges which can tear the anus on the way out. Now what you want to aim for is a 3 or a 4. A 3 is okay. A 4 is okay. But once you get past 4, you start moving into diarrhea territory, and the worst here is type 7, which is nothing but liquid. I know this as the volcano ass. It's also the night after eating Mexican, so the more you know. Now, in order to get this ideal poo, you definitely need to change your diet. Now, eating 3 pounds of roast beef is, well, a poor dietary choice at best. But to get the optimum poo, you want to change your diet to include vegetables and fruits, plenty of fiber, and more importantly, plenty of water. If you take in adequate fiber along with a nutritious, clean diet, you should see your poos change from rabbit pellets to the snake consistency. Now, the real pain comes from the largeness. You describe yours as a can, and with no lubrication in your poo, it must have been quite painful. And from the looks of what you have going on down there, it's, well, one more of those could kill you, so let's work on that diet. Now, due to the seriousness of what you have going on there in your anus, I'm going to need to use this medical grade gel to fuse your torn anus back together. Now I think that this should cure the issue, but it's quite grisly down there, so let's not make any premature promises. Now, my poo chart seems to have fallen. No matter, we're finished with it. Now, if you would go ahead and assume the position once more, I will apply the medical grade adhesive to your torn anus. Okay, yes, okay. Now just to put my fingers in here, oh God. freak out. Don't freak out. Okay. Wow, that's torn. Well, this is... I should perhaps call Guinness World Records. This is phenomenal. All right. Okay, as I suspected. Okay, unfortunately, this alone is not going to work, but not to worry, I better not touch my face with that. Last option here, now this is going to seem somewhat extreme, but you have an extreme case, unfortunately. What I'll do is put a few staples in, and along with the adhesive, that should get you fixed up. You'll be able to come back to me in about a week's time, and I will remove the staples at that time. So let's give it a shot. Okay, let's see here. Yes, just like so. Now you'll feel a small pinch. Okay. Alright. I know that hurt, but just a couple of more. On the count of 3. 1. Ha ha ha, I got you, didn't I? Okay. One more here, and we should be good to go. Get in there. Oh, that flesh is extremely firm. You're bleeding just a little bit, but that's okay. You were bleeding before. Okay. All right. That was quite a bloody business, wasn't it? Now, I'm sure you are feeling some discomfort. What I'm going to do is write you a prescription for a low-grade pain medication. Now, you will just take this as needed. You should be experiencing pain for approximately, I would say, a week. Now, after about a week's time, you come back and see me again, and we'll get those staples out of your anus. Now, you take this prescription. Yeah, there you are. Now, you have a good afternoon. Clean up your diet, and you take care of that anus. Have a good day.